Welcome to the Learning Lab. My name is Roman Garcia. This is volume 6. The lecture for today is going to be a topic that I feel compelled to discuss, and that is, what is stenosis? Now, the reason I feel compelled to do volume 6 and discuss stenosis is that what I've been noticing lately is that I've been seeing a lot of low back patients with low back issues, and what I've noticed is that they've been taken through an evaluation process, yet many of them have not had one objective test that has been basically a Stewart norm of medical examinations of patients by medical practitioner. And that is the simple reflex. Now, the reflex is a test that has fallen out of favor. And the question that I ask is, why has the reflex examination fallen out of favor, especially with patients who have low back condition, considering how revealing it is on the biological side of an examination, the reflex examination, the reflex test, the amount of information that it can give to the practicing practitioner. Now, before we start, and before you allow me to show you how the reflex is done and what's the biology behind the reflex, let me first explain a simple medical terminology, a medical term that is related to the reflex, and that is the medical word is stenosis. What is stenosis? Now, I write here the word stenosis. This is how it's spelled. This is the word right here. Now, simply, all stenosis is a closing of a space. So let me demonstrate what that is in graphic form. Now, imagine this is a circle, and this is empty space. This is a circle, and the circle, the space is closed off. Stenosis would be this right here. It would be an open space that has been narrowed by a structure, or narrowed. So it is a space that is no more. That is basically what stenosis means. So anytime that you hear the term stenosis either used in a case to describe possibly a MRI that's been done on your behalf, or a family member, whenever you hear the word stenosis, that means a closing of a space. And in biological terms, that's usually not a good thing. So what I'm going to do now is I'm going to demonstrate how the reflex is done in a standard medical examination, of which in these days the reflex is not being used as often, because I think the reflex has been replaced by more expensive examinations such as MRIs and CAT scans and other diagnostic tests. So the actual act of performing a reflex examination on a patient is something that has been lost in the medical community. So the first thing I'm going to do is I'm going to show you how it is done and the biology behind the reflex itself, and why it is so important to do the reflex whenever a medical practitioner is examining a patient. So if you allow me, I'm going to remove this. I'm going to bring in my my model, Anna. She's going to lie. She's going to lie face down, your head right here. Now, Anna, can you slide back a little bit more? Come this way. Keep coming this way. Now, the most revealing reflex is the reflex that is done on the Achilles tendon, which is this tendon right over here. It's the most telling, the most revealing reflex. It's the one that says the most about the condition of the low back neurologically. It's a very easy exam to perform. Now, before I do that and I perform the exam, let me just give you a little bit of biology of what the reflex does biologically. What is it that's occurring inside the tissues? Now, all the reflex is that you're eliciting a mechanical contraction, basically a muscle contraction. That's basically all it is. But the eliciting stimulus is a mechanical energy that you provide or that you induce in the tissues themselves. Now, it's a mechanical energy that gets transferred into an electrical current, which eventually gets transferred back into a mechanical stimulus, a muscle contraction. Now, before I do that and I elicit what the actual test, how it's done, let me show you what I mean about an electrical initiation of the reflex arc. Now, this is a TENS unit. It's an electrical stimulation device. It produces an electrical current. Now, remember, the reflex is a mechanical stimulus that gets converted into an electrical current. Now, let me show you how that's done. These are the electrical pads. They're going to produce an electrical current. Now, I'm turning on the unit. It's going to produce an electrical current. Observe what happens here in the foot. Do you see this motion right here? The electricity is generating a mechanical stimulus of the calf muscle. In essence, this is what a reflex arc does. But it gets elicited through a mechanical stimulant, and I'll show you what the mechanical stimulus is. But right now what I'm doing is I'm bypassing the mechanical stimulus and going right into the electrical stimulation to show you why it is so important that the medical examiner performs these reflexes on their patients, especially when they're complaining of low back issues. It is a way for the medical examiner to get an idea of how well that electrical current is traveling up into the low back and then going into the spinal column, stimulating cells in the spine, and then it's actually producing an electrical current that comes right back into the leg and stimulates the quads. This is the normal response of a reflex. And again, you can see the foot is jerking. This is an artificial stimulation of the reflex itself. Now, I'm going to turn off the machine and I'm going to perform the actual reflex itself. Now, it is very important for patients to have this reflex. When they have this reflex, what that tells the medical practitioner is that the nerve impulse is coming into the spinal column and then exiting and going and stimulating the muscles itself. So that what that tells the medical examiner is that the space where the nerve comes in and the space where the nerve comes out, that space is patent. It is not stenotic. That is very relieving. That is very revealing for the medical examiner, and it should be a great relief to the patient when they are told that the reflexes are normal. Because in essence, that is what the reflex says, is that there is no stenosis inside the spinal column itself, which is how you want a low back to be. You do not want stenotic conditions inside the spine, because when a patient has stenotic conditions inside the spine, their usual complaint is the pain radiating down into the legs or numbness into the foot or into the lower leg. Now, let me show you how the reflex is done. Now, you just simply, the medical examiner has to create a little bit of tension in the calf muscle. Once you do that, basically you put the muscle in a state where a mechanical load will get converted into a nerve impulse, or in essence, an electrical impulse that travels into the spine. Now observe the foot. Some folks have stronger reflexes than others. We'll see what kind of reflex Anna has. If you allow me, can you just observe the calf muscle? I can feel the calf, the foot. I don't know if you can observe that, but the foot jerks. Now what that tells me is that Anna is not stenotic on the left side. This mechanical stimulus is being converted into an electrical impulse. It's going straight into her spine, coming out and eliciting a muscle contraction. Left side of the spine is not stenotic. Now we're going to go to the right. Again, contraction. Again, mechanical stimulant of the tendon converted into an electrical impulse, going straight into the spine, coming out of the spine and stimulating a contraction of the calf muscle. She's not stenotic on the right side. Now, the reason that this reflex is so telling is that this reflex arc is relatively simple biologically and physiologically. But this reflex arc is very sensitive to hypoxic conditions, or conditions where oxygen is not traveling or diffusing into the spine that is responsible for this reflex arc. It is the most sensitive to hypoxic conditions. So once you start getting stenosis inside the spine, the first biological sign of that stenosis is this reflex arc. It's very sensitive. It's the canary in the cave, basically. In essence, that's what it is. Again, contraction. No stenosis. Contraction. Contraction. No stenosis. So if Anna would come to me with a low back problems, this test would be very telling. It would tell me that she does not have stenosis in the spine, so I do not have to concern myself with a stenotic condition inside the spine, which would make the patient's condition much more complex. Now, what I'm going to do now is I'm going to show you what a stenotic spine looks like on an X-ray. If you allow me, if you can get in here. Now, this is a view of the lumbar spine. This is number 5. This is number 4, 3, 2, 1. These black spots right here, those are the spaces where the electrical energy stimulated from your reflex, where it travels into the spine and where it comes out. Basically, the nerves of the lower legs all come out of these spaces right here. Now, you see here that in between, this is number 1, this is number 2. This space, this blackness right here, that means it's open space. This is a non-stenotic area right here. This is a non-stenotic area right here. Again, you see this blackness. This is open space. Non-stenotic space right over here. It's starting to get a little bit white and fuzzy. They're starting, this level right over here is starting to develop degenerative changes. But you still see some blackness. It's still a relatively open space. Now, observe this space, this area right over here. This area right over here. This is the space where that S1 reflex comes in and comes out. You can see on this patient's X-ray where it's very white and very fuzzy. This space right here, X-ray wise, would qualify as a stenotic foramen or a stenotic space. You see it right here, very white. Compare it to this space right over here. Black, very white. This space right here, this is L5S1. This reflex that you just saw earlier is the electrical energy comes in through this space and comes out through this space. If I were to do try that reflex on this patient, that I will not get that ankle jerking because the electrical impulse is getting blocked right here. It's getting blocked right here. It's not going into the spine itself. So it's getting blocked right here. So the impulse, since it doesn't come into the spine, the impulse does not come out of the spine to stimulate the calf muscle, which causes the ankle jerking. So this is a stenotic space between L5 and S1. Excuse me for that. Again, stenotic space right here. Now, what do we learn here? What we learn here is that if you have a low back condition and you go to a medical examiner and they do a physical workup on your condition, on your complaints, and they do not perform a reflex examination, especially of the Achilles tendon, then you are not getting a complete, proper medical examination of your condition. Low back conditions have two possibilities. They're either stenotic or they're not stenotic. You, as a patient, you have to know exactly where you fall into, the stenotic or the non-stenotic. And one of the most telling, most sensitive examination that can be done on a patient is that simple S1 reflex. But unfortunately, it's one of those examination tests that has fallen by the wayside. But I think it needs to be brought back into the physical examination. As you can see, it's a very easy examination or test to perform, and it's very it tells a lot about the patient's low back condition. Again, for anybody who's seen this video, I want to thank you for watching this video. If you have any comments, if you have any suggestions on how we can improve these videos, please let us know on YouTube. Until next time, thank you for watching.